Cytokines. Cytokines act in a lot of different ways. Cytokines are sort of like that 911 call. When tissue is damaged, when a cell's damaged, it's dying, sends out a call for help. And that's cytokines can do that. Interleukins, many cytokines are types of molecules called interleukins. And interleukins are responsible for the fever that you get. These are the chemicals that say, okay, let's tell the thermostat in our brain, the hypothalamus, let's tell the thermostat that we need some more heat. We need to turn things up. So it is the interleukins that is responsible for fever. Interleukins is responsible for fever. Talk about interleukins used to treat cancer. Also something called interferon, that's what I was looking for. Interferon, this is a chemical that our body releases specifically for viruses. We have a drug that we use called interferon. Have you heard of this? Do you know what kind of patients get this? Do you know? Lupus, HIV, Hep C. That's where you hear it, with Hep C. Hepatitis. Interferon.
I'm going to call it perhaps in the...
I'm sorry?
I'm going to call it perhaps if that is interferon for the disease. Perhaps. And lupus, especially.
But it's never lupus.
It's or lupus or I forgot the second one was.
Hepatitis.
No.
No.
Sarcoidosis?
Sarcoidosis?
Yeah. It's that or lupus.
Could be sarcoidosis. You'll hear about that a lot, especially when they're smokers. Tumor necrosis factor. This sounds like something that kills tumors, right? Tumor necrosis factor. That's kind of what it does. This is interesting. The complement cascade. You want to talk about confusing? We have these proteins, right? And there are, I don't know, 2 dozen of them, just under 2 dozen of them, I think. And they are simply named complement protein 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, etc. But there are some that have like subgroups, some subcategories. So you'll see complement protein 3A, 4B, 5A, 5B. Now these things are cool because when these when these antibodies attach to these antigens, remember, they're calling for help. Here's our antigen sticking out, and our antibody attaches to it. And while it's waiting, for other cells to come in and now recognize it and destroy it, it can activate the complement cascade. And one of the coolest things the complement cascade can do, and it uses 5B, 6, 7, 8, 9. It gets these components together, and they attach to the antibody antigen complex. In other words, this whole unit now. They attach to this, and they create a drill and they start punching holes through the membrane of this cell, this foreign cell, figuring, well, we got you, we've locked onto you, it's only a matter of time before, we have these other specialized cells come in and destroy you completely, but while you're waiting, how about if we start drilling holes through you? Because of course, if we drill holes through a membrane, what's going to happen? Stuff that the cell doesn't want inside is going to leak inside. Stuff the cell doesn't want to lose is going to leak out, which is going to contribute to the cell's death, right? That's pretty brilliant. That's a 1-2 punch, man. You like apples? How do you like them apples?
Let's do that for AIDS.
Let's do it. You sounded so enthusiastic about it. Let's do that for AIDS. Let's do it for Johnny. So that's an outsider's reference.
I got it.
Thank you. Did you really? Wow.
Stay gold, my boy.
That's frightening. All right. I apologize for that. Please open that.
Oh, I'm putting
So
this
this is cool stuff. This is what our body does. We don't have to think about this. This is happening like right now inside of you. That's absolutely brilliant. Very cool stuff. I mean, who thinks of that? Who says, we're going to attach these things that'll fit perfectly onto this guy specifically so that we're going to light them up like a neon sign so that we can have our specialized cells come in that already know how to destroy it because they already have that information. While this cell's waiting, we're going to drill holes into you. This is mean. Okay. Inflammation. Now again, please understand what inflammation really means. Inflammation is that 911 call, those cytokines, and then all of the cells getting there, trying to destroy whatever's there, trying to fix whatever's there. Everything rushing to the scene. When everything rushes to the scene, that's going to cause other things to happen. That's going to cause the swelling and the edema and the pain. But that's not the inflammation. The inflammation is all that chemical stuff happening beforehand. So I understand that these books sort of always include inflammation and edema and swelling as the same thing. But I want you to understand there is a difference. Inflammation, deliberate action. We want to do it. We want this to happen. Why? Well, because there's a problem. We want to be able to fight it up. However, that inflammation can cause a lot of tissue damage, right? It can increase swelling in the area, compression. Other blood vessels get compressed, capillaries get compressed, less blood flow, more tissue necrosis, more pain, etc. That's often why, when that person has that staph infection, a little staph infection in their skin, it'll look like a little white head, and it'll be red all around it, and it's a little bit swollen, and they'll talk about how much pain it hurts, and hurts, it hurts, it hurts. And so what do they do? What does the doctor do?
Clean it.
Cuts it open. You cut it open, you drain all that pus out. And what do they say? Oh, that feels so much better. Why? Because we just reduced all that pressure, right? Took all that pressure off everything. Slice it open. Just be careful when you're slicing these things open, because the stuff's under pressure. Even if you're numbing the area, when you get to that point, you'll find that when you go to stick lidocaine in, you always have to cover it up when you're sticking lidocaine in, because otherwise it'll squirt right back in your face. So even wear glasses. Those little things, you'd be surprised. Those little things can be under some serious pressure. Hold on a second.
Watch down. Gross.
Body tries to wall off an area of margination. This is how granulosis occur. Okay, that's what I was talking about. Okay, talking about that. cheap chart, you can read through it. It's basically all the stuff we just talked about. Fever. We know what fevers are.
Ebola.
Remember though, fevers don't have to be reduced all of the time. This is the body's way of fighting something off. If it's a low fever, let it happen. That kid has a low fever, let it happen. A kid can tolerate a pretty high fever, you'd be surprised. A kid can tolerate it and not feel uncomfortable. Let them have the fever. Anything over 103, you're cooking. Inflammation becomes a more serious problem in confined spaces. That should be no surprise, right? Inside of the cranium, that cranium is a solid space. If there's inflammation, well, the inflammation isn't really the problem. It's the stuff that comes with it, right? All that swelling and edema. Because now we have a pressure problem. Anaphylaxis is a systemic inflammation. We've heard of this, right? Look at this. Here, listen to this. Look up here. Systemic inflammation called anaphylaxis causes huge drops in blood pressure due to widespread vasodilation. Okay? Anaphylaxis can be fatal unless treated immediately by a professional like you or me. Now, when we treat this, what do we stick into them? What is that medication? Epinephrine.
Vasoconstrictor.
Is that something one would expect to find in the sympathetic or the parasympathetic pathway? Sympathetic. And what does it do to the blood vessels?
Vasoconstrictor.
It does what? Show me. If a blood vessel is like this, what's it going to do to the blood vessels? Is it going to make it bigger or is it going to make it smaller? It's going to constrict. It's going to constrict. You see the problem here? We have widespread vasodilation. So we're going to give a medication that everybody hopefully knows does this. Right? Do you see the problem between this and this? Be careful. I don't know why you missed this on the test. Sympathetic. Constriction, increased blood pressure. You can't increase blood pressure if you vasodilate. Right? All right, we know what fevers are. Interleukin, there's several interleukins, but just make the mental connection. Fevers, interleukin, fevers. Actually, we did a lot of that. Two types of proliferation. Proliferation of helper T cells. We've already seen that. We were talking about how so you get that information. Again, I think that's on page 402, right? That same picture.
Yes.
It shows a helper T cell making a copy of itself. A daughter helper T cell, yes.
Yep.
Helper T cell proliferation. So it releases these things that will activate the B cells, and then it will release these things and it will activate itself to say, okay, make a copy of you so that we have this information, because clearly we're going to need more of us. So clone yourself. And there it is. I guess I could have just one more slide. And this stuff is happening right now inside of you. Very nice table. I would suggest reading through it a couple of times. You don't necessarily need to know the different interleukins. acquired immunodeficiency syndrome, or AIDS. Now, why did we put the word acquired in the title of this disease? What does acquired mean?
Developed?
Someone else?
Maybe not so much developed. Maybe didn't have it before, now you have it. Developed sort of suggests that
You mean?
it was in an earlier state and you've somehow changed it into this, which is not really correct.
Okay.
Acquired means like you bought a car, you acquired it. Made means like you made an apple pie. You took the ingredients and you put them together and you made a delicious apple pie that I'm going to have another slice of in like 3 minutes. And then we're going to have another one of this cookie. Just take this.
And an insulin shot.
All right, so it has the word acquired in there for a reason. It must be because there are other immunodeficiency syndromes. You know, like ones you're born with. Did you know that you could be born with an immunodeficiency syndrome? Have you ever heard of the bubble boy? This was something a long time ago, they made a movie about this. This was a child who had something called severe combined immunodeficiency. There's common variable immunodeficiency. There's Bruton's gamma globulinemia, the type of immunodeficiency. There's lots of different immunodeficiencies. This one, however, is unique because they weren't born with it. Now, that's got to be a little scary when you first realize this. When you first realize that there are immunodeficiency diseases that will kill you if you don't live your life in a bubble. Quite almost literally, obviously, in the one case. And if you're born with it, you think, okay, well, I'm safe because I don't have it now, so I'll never have to worry about something like severe combined immunodeficiency. And then you go ahead, not you, patient, catches it. They acquire it. That's pretty frightening. Immunodeficiency virus. This is a virus that is targeting the helper T cells, specifically the CD4 cell. I already told you about that. Patients with full-blown AIDS. Look at that. Why did they do this? Patients with full-blown super AIDS. I've gotten that question before. If a person with AIDS has sex with another person with AIDS, do they then get super AIDS? They do not get super AIDS. They get double AIDS now. AIDS squared.
Negative.
They don't get negative AIDS.
Oh, they cure it.
Cure it. No, they don't cure it. Stop it. You know what happens? Nothing. They still have AIDS. Patients with full-blown AIDS. The criteria for a patient going from HIV positive to having AIDS is very, very clear. They must have some opportunistic infection like the pneumocystis carinii pneumonia, or now it's called pneumocystis jirovecii, or Kaposi sarcoma. And their T cell count has to go below 200 cells per cubic millimeter. It's very simple. That's the criteria. Just like peeing on a stick. There's either a plus sign or a negative sign. Nobody's sort of pregnant. And nobody gets full-blown pregnant.
Super pregnant. Super
You
pregnant.
could be super pregnant though, with like
I like
multiple.
what I know.
Would you say it's 200 cells per what?
Cubic millimeter. MM superscript 3. Talk about those. cells, activating complement cascade, primary response, talk about that. Memory cells allow even on a faster response is secondary. So the primary adaptive is slower than the secondary adaptive. 4 types of T cells. Regulatory T cells used to be called suppressor T cells because they sort of kept the immune system in check. To say, you know, we don't need you guys doing so much right now. We've already sent, you know, police to the scene. You can relax. Okay. All right, let's, you know, let's take our lunch. Don't get too much. It's